This is Dr. Corey Maas on Looking Your Best. I had a question today that was brought to me on a patient that had had a previous brow lift surgery about improving the scar. And this patient had gone from basically a full-headed hair look to pretty much a shaved-headed look, and was concerned about the appearance of a depressed scar. It's very similar to a patient that I treated that was injured in Vietnam with a explosion of a hand grenade or a rocket-propelled grenade, and a number of his platoon members were killed actually, and he had a number of scars on the top of his head, many of them depressed, widened, or elevated. And those scars, when he lost his hair, became quite noticeable and brought back memories of that Vietnam-era injury to post-traumatic stress disorder. And we were able to help him enormously by revising the scars. In the case that was brought forward today, the scar was relatively small compared to that case, but the principles were the same. And that is that the scar was depressed, meaning that it was not even with the surrounding skin, and thus there was a shadow created in certain lights which brought attention to the scar. And in general, I've talked about the 4 principles of scar revision, or 4 things that make them noticeable, whether the scar is depressed or flat or even elevated in some cases. The color of the scar matching the surrounding skin. The width of the scar, is it really far apart from the edges of the normal skin, or is it really close? It should be within a millimeter or 2, the edges themselves. And then the direction or position of the scar. And in these cases where there's light creating a shadow effect, which brings attention, what we like to do is typically revise the scars. And there's a couple ways of doing that. There's a newer product called Bellafill out on the market, which is a permanent correction or filler that lifts it. It's polymethylmethacrylate, and it's been around for many years under different names. But for isolated conditions like a scar, I think a product like Bellafill, which is a microparticulate synthetic, it can be injected in very small amounts, creates collagen in the place where we inject it, and elevates the scar. Really any filler, Restylane, Juvederm, the Bellatero product can be used in these areas to lift the scar. However, those are not permanent, and they are excellent ways of testing the elevation using a filler, which is a nice way of non-surgically improving a depressed scar. Typically, the surgical approach is to take out the depressed area surgically. Obviously, we use numbing, and in cases where people are nervous or that requires a little more surgical intervention, we can actually have them lightly sleeping or sedated, but it can be done in the office in most cases. With local anesthesia, I'll take out the scar and elevate the edges and close it so that the edges are everted, sort of like a steeple. And then when it heals, it comes back to being nice and flat. If we can do that and keep the scar width within a millimeter or 2, we can make a depressed scar like the gentleman that had the brow lift have a scar that's much less noticeable. Other factors in hair-bearing areas like the scalp include the loss of surrounding hair. Often I'll have patients come after brow lift and tell me they're unhappy because they lost hair around a scar. In many of those cases, it's just a simple temporary or transient condition called hair shock, and we'll do little steroid injections to reduce the inflammation and encourage the hair roots, if you will, the follicles of the hair, to start growing again. In other cases where it's long-standing, we can take non-hair-bearing areas of the skin out, the scalp that's basically bald, which represents the region of the scar, and bring the hair-bearing areas very close together again. They're within a millimeter or so. It's very difficult to see a spot that's bald, even if it's a scar on the scalp, a very narrow scar like I just described. So those are a couple options that are available for people that have scalp scars, whether you have hair on your head and it represents a bald spot, or you're going with a very short look, which is very popular now. The treatment will depend on the condition that you have. They range from surgical options, including excision and repair. There's lots of different types of excisions and repairs, but I described one of them. And there's also the option of using fillers, now permanent fillers and synthetic fillers that are non-permanent, like the long-chain sugars, the hyaluronic acids, known as Juvederm, Restylane, or Bellatero, which are commonly used. All of these are of great benefit to people who are bothered by scars on the face or scalp. But if you have any questions about them, I encourage you to send in photographs or pictures of them. I'm happy to respond to you privately or publicly. If you don't mind sharing the image of the scar, I think it benefits everyone if we can share this information. And I'm always welcoming questions about things we can do to improve our our appearance, and our well-being. This is Dr. Corey Maas on Looking Your Best.